Hello, clients, website visitors, and YouTube followers and subscribers, or those that just Googled us and got here. So, we have a client who lives in Santa Barbara, has United Healthcare AARP Medicare Advantage, and he's looking for a PPO Medicare Advantage plan. And it doesn't really exist. And I'll go through in this video explaining what's on my website, what I've answered to the person, what I've researched, and so forth. So anyways, here's where we were asked that they heard Blue Shield has a PPO in Santa Barbara. Can I send a link? So I really don't like going by what people say they heard. I want to know exactly what it is. But anyways, I'm an authorized Blue Shield agent. I've got all the materials. They don't offer a PPO Medicare Advantage. They do offer Medi Gap, but that's generally a higher premium. In a Medicare Advantage plan, Medicare pays the insurance company around $800 a month to take care of you, and Medicare figures that's a deal because then they don't have to do the administration. So all these links and everything that I'm going through will be at the bottom of the YouTube video and wherever I post it on this website. I haven't decided where I'm going to post it yet. Probably right here where he asked the question. So, and we do welcome your questions because that's how we build our website and become more authoritative and more knowledgeable. So, and also you can set a Zoom meeting with us and we'll go through that in a second. Well, I can show you right now. If you come to our Zoom page, you can set a time. So even today, Sunday, we are available later when we get back from tennis. And we pretty much have open times, but I need you to set an appointment so that, we've got everything ready and can answer your question, here for this video, just to explain about what's available in Santa Barbara or really any county. It's like the same issue. But it takes a while to set that up and be ready. So it depends, if you want to wait on hold while I look stuff up or just tell me the question and then we get back to you. So, here's, where he asked the question. It was in an email, so I just made it anonymous to keep his privacy. So presently, United Healthcare is $89 a month. But Blue Shield just came out with a PPO in Santa Barbara, and their rate is $0. We're not allowed to say that it's premium free. I probably go to jail for that from the federal government. They're very strict on Medicare Advantage rules. Okay, let's go to the next web page. If you call up and say, what's the best plan? We're not allowed to answer that. We'll go to jail or something. And, I kind of resent doing the annual training every year for Medicare Advantage because they don't teach us anything. They show us slides that say you're going to jail if you show it to anybody. I wish that they would just use the official publications that we could show you. So, we can say best if we can back it up. Now, if you mean by best, the best premium or the lowest premium, well, Blue Shield this year has that. Here we have, if you want to go Medicare or Medi Gap, Blue Shield has Underwriting holiday. Normally, if you want to go from Medi Gap back, if you want to go from Medicare Advantage back to Medi Gap, guaranteed issue, you can only do that after the first year being on a Medicare Advantage plan. There may be some others. You have to look at my page on guaranteed issue. But basically, it's a 1-year trial period. And then when you read it again, it's a 1-year trial period if you had Medi Gap in the first place. So if you came in at 65, got Medicare Advantage, and then you don't like it, you don't have a guaranteed issue period. But right now, Blue Shield is having an underwriting holiday, and you can get into a Blue Shield Medi Gap if you have a Medi Gap with Blue Shield or any other company, or you have a Medicare Advantage with the other company. So that's not, you just never know when they're going to, come up with that. Here's my web page on Blue Shield Medicare Advantage. And so there's, different options that they have. And the main difference is like the list of doctors. In here, you can use the search engine to see, if your doctor's on the list for that HMO. And, we also have a page for print directories if you like that. And then I like my clients to know exactly what's going on. So I have a video here on official video. Well, the video is not official. I did it, but I based it on the official publication that Medicare put out on understanding Medicare Advantage plans. And then here we've got all the detail. To enroll, just click here and you can enroll. Blue Shield, when the link is on my website, Blue Shield will know that I'm your broker and everything's cool. If you need help, we can do this over a Zoom meeting. The way things are going with COVID, I personally don't see an end in sight. We're in Los Angeles. We've got a 3-week stay-at-home order. And I don't see that they're going to open up, for Christmas or New Year's. I think that Christmas and New Year's are out too. Here's the print directories for Blue Shield. Now, all of this stuff is available for United Healthcare, but United Healthcare doesn't really allow agents to put anything on their website. So just email us and we can send you all the documents for United Healthcare. Now, Medicare Advantage PPOs are few and far between. The only one that I have is Blue Cross, and that's only in Orange County. So, here's our webpage on the Blue Cross Medicare Advantage plans. And so if you want the full details, it's in their evidence of coverage. And probably 95% of questions people ask are in the evidence of coverage. Now, I'll grant you it's 268 pages, but the question that you might ask is only one page. So we're happy to send you that one page, and we prefer sending you the one page because we don't really feel we can do justice in a one-sentence answer what took the insurance company 2 or 3 pages. Now, you may be intimidated by this, but they're mandated to put this in plain English. And so people ask me sometimes complex questions, and it's like I can go look at the law, and then you're spending hours trying to explain it. The insurance company, lawyers, and everybody else has already done that to put this in plain English. So, and I didn't really find a decent summary of benefits in there, but some evidences coverages do. So here's the Blue Cross Medicare Advantage PPO. And so even if you did find a PPO, you may not be happy with it because while it allows you to go to any doctor, sometimes the out-of-network charges may make it not reasonable for you. So the Blue Cross PPO, and this is in Orange County where virtually every other Medicare Advantage plan is 0 premium. This one costs $172 a month. Your deductible is $590. Your maximum out of pocket is $10,000 instead of $6,700. So if you're going to their doctors, it's a big advantage. Inpatient hospital is $175 when you use their doctors, 40% if you don't. Doctor visits, are $10 copay if you use their doctors, 30 if you don't. Specialists, $35 or 50 if you don't. And preventative care, that's a big thing under Obamacare, and I'm not sure how long it's really been there in Medicare. But if you go to preventative services, it's zero copay, and that's what Obamacare mandates. If you go to outside doctors, you pay 40%, annual physical exam. Here's all these preventative care things. Emergency care, you can go in or out of network. They're not surcharging you for that. Diagnostic radiate. So anyways, it's all higher. And so if you really want to, be able to go to any doctor, any hospital, anytime and get paid in full, you probably should go Medi Gap. And we'll get into that in a minute. So I don't represent every company because aside from the 8 to 10 hours of doing the national exams and waste time, and I say waste time because they'll go over the same thing every year, and they don't allow us to show the client their PowerPoints, and I wish they would just use the official publications. So anyways, Medicare has a tool, and I do have another video on my website to explain how to use their tool. But anyways, they have a tool to look at all the Medicare Advantage plans in your county. So the Blue Shield 65 HMO is zero premium, and you can click here, get the plan details, primary doctor, zero copay. If you put in your prescription drugs, it'll tell you what you pay there. Now, AARP, Patriot, and when I started this business, when I had brown hair and all of it, you could tell from the name of the plan, exactly what the plan covered. So Patriot looks like a deal, but it's only really good if you're in the VA and you have your prescription drugs from the VA, and then you could get this. But if you're not, then you're screwed because, it doesn't have drug coverage. And if you have a Medicare Advantage plan, you can't go and get drug coverage from somewhere else. So there's all these rules. You got to read it 3 times. And when then you think you understand it, you got to read it again or, check with me. Imperial Traditional, I don't know who they are. Doesn't mean they're bad. I just don't know who they are. I don't represent them. Humana is $49 a month. And AARP Secure Horizons, which, my client has, is $89 a month. So they do have a way, and I've sent him the PDF of clicking compare. Well, I'll just show it to you briefly. So you compare the $89 to the zero premium with Blue Shield. Click here, and it compares it. Now, see, the federal government also throw agents in jail for comparing 2 plans without getting permission from each company. So yeah, I could send you each company's brochure, but to do a comparison, you have to get permission and all this. Well, this is the federal government, so I guess they've got permission or they make the rules. So here it'll show side by side, what it is. And, your deductibles, if transportation is covered, dental, telehealth, all these things. So if you have trouble, we can send you this as a PDF and so forth. So just off the top of my head, I'd say, yeah, let's go for the Blue Shield. But the other thing you'd want to check is if your doctors are on that list. A lot of times Yeah, this is one thing. I've got pretty fast internet, so I'm thankful for that. But a lot of, well, let me find it this way. Um, a lot of times it's just easiest to go right on your doctor's website and then see what plans they accept, as opposed to using the insurance company's site and keying in all your doctors. So I'm in Los Angeles. A lot of people are asking for UCLA, and Blue Shield does cover UCLA. And then I have links to right to UCLA's website so that you can check there of what plans that UCLA takes. And then they go through and they say like what Medicare plans, what Medicare Advantage plans, if you're getting the coverage through your employer. So say like if you're on Medicare, but your wife, works, then you have two different things to look up. So yeah, I know it's complicated. Send us an email. We'll answer your question. We love answering questions. Let's go back here because I go in order left to right of what I pulled up. So if you want to set a meeting, just go to our webpage, set a meeting, and we're available. We'd love doing it over Zoom. You can see exactly what we're talking about. We can get you enrolled. We can answer all your questions authoritatively. One of the things about Medicare is people think it just should be free, but no, your spending is $19,000 on average. So it's not like money just grows on trees. This stuff costs money to do, and that's why you're not getting everything in the world just because you're 65 and paid into it. On my website, I've gone through and made videos of, all the time, and I try and go by the official brochure so that you can't say I made a mistake or misled you. I'm trying to use the best material, authoritative materials around, and not something somebody told me. Because when I go to insurance seminars, maybe it's because I have gray hair already and I've been in the business since I had all my hair and it was brown. But a lot of the reps and people around just give you answers off the top of their head, and they think that that's authoritative. No, I got to see it in print from the law or from the actual insurance company. So on this page seminar, I had one of my clients say, gee, I'm turning 65. I don't understand all this stuff in writing. Could I recommend a seminar? Well, the seminars are not put out by Medicare as a public service. All the seminars are put out by agents like myself, or the insurance company that puts on a seminar. They'll tell you a little bit about how Medicare works, and then it's like, buy our Medicare Advantage plan or our Medi Gap plan because we're great and wonderful and we'll fill all the gaps. I just really, well, now it's COVID, so you really can't do any seminars. And if I give you lunch, I can go to jail. You're only allowed to give coffee and a donut, and it gets all confusing and yada, yada. So anyways, on this page, I've got the video about understanding Medicare Advantage plans and then Medicare and you. So I have a lot of people say, Medicare is too complicated. They should make it simple. Well, yeah, Medicare and you is maybe 120 pages, but it's well worth at least flipping through. A lot of the pages you're never going to use because it tells you about, foreign languages. And while I am studying Hebrew, Croatian, and Spanish, of course, living in Southern California, I only conduct business in English. I'm not fluent in those other languages. There are translations available, and So just ask, we'll get you the translation, and we'll see if we can refer you to an agent that's a native speaker if you're not really able to conduct business in English. So here kind of explains, what's covered in A and what you get paid if you have a Medi Gap or Medicare Advantage, what you pay after that. And then part B is your medical insurance, what you pay after that. We've got a video on Medi Gap, videos on how prescriptions work, video on how to use the Medicare tool, how to apply for Medicare, how to create a Social Security account, your preventative guide to Medicare services, skilled nursing, long-term care, home health care. So while I'm telling you there's home health care, you really need a long-term care policy if you want to be properly protected. Medicare does pay some of that, but they don't pay for maintenance. Hospice benefits, mental health, and so forth. Here's our webpage on Introduction to Medicare Advantage. And, I would suggest that you watch the video on Medicare Advantage. So, it doesn't look like I have it on this page. Well, let me pause this for a second, make a note to do that. No, this is my introduction to everything. So from here, you can just go and visit the other pages. Here's our Blue Shield, page for Medi Gap. And Medi Gap is what you should get if you can afford it, to truly allow you to go to any doctor anytime you feel like it. You don't have to get a referral to a specialist or any of that other stuff. So this is our page that explains Medi Gap. We also do Blue Cross. And then here's the rates for Santa Barbara. So if you're, let's say, 70, Plan G is generally the plan to get, and that's $154 a month. Plan G Extra, give you extra benefits for vision, hearing aids, and maybe some dental. And then Inspire, this is why I like you to email me. I'm not really familiar what Inspire is and if it's worth, like $15 a month more, but we'll get you that brochure. Just go back here to the plan and then look here, plans at a glance. And, it'll kind of explain it to you more here. And then if you want to really know more details, look at the summary of benefits. Right there, that's the Plan G, but just scroll down and it'll show you like Inspire and so forth. I already spoke about this, but often it's just easiest to see what plans your facility accepts. And then here it is on their site. So if you have any questions, best way is to email us. If you'd like to set a meeting, go ahead and do that. Let us know what your questions are so we can look up and give you an authoritative answer. Thank you very much.